Hello and welcome to the Homeopathic Essential Facebook Live event. My name is Christophe Merville and we'll talk, of course, about homeopathy. And I wanted to thank first the Holistic Mom Network, who is our partner in this event. Holistic Mom Network is a national profit with local in-person support community for parents that are interested in gentle parenting and natural living, and they encourage parents, of course, to trust their instincts and parent from the heart and live naturally. So thank you for Holistic Mom Networks. During this presentation, we'll give out three prize packs, and so during the broadcast, and that will be those prizes will have a little kit for cold and flu season, survival kit. You'll find Chestol for cough, as a cough syrup, oscillococcinum for the flu, cold can for cold. Well, it's a nice little package. The retail value is about $70. So stay tuned, and I don't know how it works, but you will probably see those prizes attributed. So my name is, as I said, is Christophe Merville. I'm a pharmacist. I was, as you can hear, trained in France as a hospital pharmacist, and I've been with Boiron for quite some time, since 1990, and my role is to participate to education and pharmacy development. So that's why I'm here today, answering a lot of your questions. Some of you have already posted some very interesting questions, so I'll try to enlighten them. And of course, I'm sure that you will ask questions. There is a whole team behind trying to see and send me exactly what you need. So I hope you'll comfortable, you'll enjoy the show, and let's start. So the Boiron company is in fact a company founded in France in 1932 by two twin brothers, and the mission of the company is to help every healthcare professional and every person to integrate homeopathic medicines as part of their daily practice or their way of treating themselves. So we really want to inform, educate, not only of course on our products, but also on simple, natural, safe ways in order to stay healthy and to have our kids stay, of course, healthy and go through the inevitable problems and little diseases and so on as safely and as efficiently as possible. So homeopathy, what is it? Well, it's a therapeutic method. It's a way to treat ourselves. So it has been discovered or invented more than 200 years ago, and it has grown very successfully. Now most countries integrate homeopathic medicine into their healthcare system. What can I say about homeopathy? It's I like to say it's a tool in the toolbox. I like to say that if you have that special tool, it's like if you have a toolbox without a Phillips screwdriver, well, you are missing something. So homeopathy is a little bit like that. It does not replace all conventional treatments, but in many cases, and we'll see a couple of them, it's very, very useful to try because, in fact, as you will see, it's very safe. So what is it? Let me give you an example of what homeopathy is. You drink too much coffee, and unfortunately, you have to go to sleep, and because you drank too much coffee, you cannot sleep. You have racing thoughts, you're tossing and turning in the bed, waking up, going to the bathroom, coming back, trying to sleep doesn't work because you simply have too much caffeine in your system. So let's take a person who has similar symptoms. For example, you worked very hard all day, and you're tired, but you go to bed, and for some reason, you can't fall asleep. Or you wake up in the middle of the night, and your brain doesn't shut down. You absolutely, you have those racing thoughts, you're agitated, and so a homeopathic preparation from the coffee bean will relieve the symptoms. Let's take another example. You know what happens when you're peeling and chopping a lot of onions without those little contraptions. When using only a knife, very soon your eyes will be itchy, you'll start sneezing, you'll have a watery, irritating, acrid discharge from the nose, and everything will be better if you breathe fresh air out of that window. So if you take a person who starts to have a cold or has hay fever episode, and that person has similar symptoms like runny nose with a very clear water discharge irritating the nostrils, spasmodic sneezing, itchy eyes, the whole thing improved by breathing fresh air, a homeopathic preparation from the onion will relieve the symptoms. So it's very simple. So those homeopathic preparations are using very tiny doses. And that's also important to know because those doses are small enough so they don't create side effects, but they are still able to stimulate, and well, learning research is ongoing on how it works. Those tiny doses are able to stimulate our organisms to go through the to heal itself, so to restore health. We start to have, it's very interesting because we start to have few research that emerges and tell us, okay, this is a very interesting hypothesis, how we could work and so on. But the fact of the matter is that it has been used for now more than 200 years, based largely on empirical research and experience. And it's quite reliable. A lot of people say, well, once I tried homeopathic medicine, I go back to it. I trust them. So this is very exciting. So let me try to find a couple of questions that we have here already that have been sent to us, and it's mostly about kitchen, about children. So let's see that. So I hope the sound is okay. Yes, let's check that. Perfect. Okay, good. So there is a question from I think it's various members. In fact, several of you have already asked a question about baby teething. Babies very soon start to have teeth, and sometimes it goes okay. Sometimes there is a little bit of congestion in the gum, and the baby, who is usually quiet, is restless and starts expressing the pain and discomfort. What can you do? What are the different solutions? Well, you have a lot of things you can do without using medicines. You can certainly use one of these cold things, plastic things, so the baby can chew, and it speeds up the emergence of the teeth. Or you can use, and let me show you that, you can use one of our medicines called Camellia. Let me show it to you. So the advantage of Camellia is this. Those are liquid unit doses. So you just have to squeeze the dose into the baby's mouth. So a few drops are falling in the baby's mouth. It doesn't have any taste. It's not numbing the gums, so there is no problem with the swallowing reflex or the gag reflex. You know that benzocaine sometimes can numb the back of the throat, and the baby doesn't swallow very well. It contains several different active ingredients. One works on the pain and congestion of the gum. One works on the sensitivity to pain, what causes the child to get a little bit angry or not really joyful. So that's going to help on this side. And the third one helps on digestive problems that are sometimes associated with teething. So very easy. I like the fact that those are liquid because there is no risk of choking, and it's quite easy to administer. There is no risk of contamination and so on and so forth. And it's preservative free, very natural, so that would be a good solution. Easy to find. So once again, Camellia. Let's take another thing. We have a question about asthma, and so For chronic conditions like asthma, it's not something that really you can treat by yourself. Asthma is not a condition that is susceptible to be treated by self-medication. But you have homeopathic solutions with this. For chronic conditions, homeopathic treatment needs to be designed very specifically. That means the physician skilled in homeopathy would assess the condition of the child and how the child reacts when it is worse, what triggers it, what improves it, what aggravates it. And in order to do that, you need to find, of course, a doctor who is a pediatrician who is skilled in homeopathy. So my recommendation is to go to the National Center for Homeopathy site. National Center for Homeopathy, and the website is homeopathycenter.org. homeopathycenter.org. They have a list of physicians, MDs, pediatricians that are skilled in homeopathy, that will use homeopathy when it's appropriate, and of course that know how to medically assess children with asthma. So completely out of the scope of self-medication. They are very great medicine to treat asthma attacks, to really reduce the frequency of the asthma episodes, to really try to avoid as much as possible medicine that could have side effects. Sometimes they are necessary, but the beauty of the thing is that you can combine conventional and homeopathic medicine, but all that needs to be done under medical supervision. Go to homeopathycenter.org, you'll find a list of physicians. So that's take care of the asthma. There is another one on depression. Same thing. Depression is especially, well, I don't know if it's for children or not, but depression is a grave condition. Sometimes it's relatively short. It's after due to grieving or reactive depression due to a sad event, and but it needs to be medically treated because it's not really not to be confounded with sadness. Okay, but I encourage you also to go on the NCH National Center for Homeopathy website to find a physician skilled in homeopathy that can really address that. Now I have a lot of questions about lactose. Lactose is what we call an inactive ingredient that has been that is traditionally used to medicate, to prepare homeopathic medicine. And you have a certain number of people that are intolerant to lactose. They don't have the enzyme in their intestine to metabolize lactose. So if they eat too much dairy, they will develop symptoms like bloating and other embarrassing things. It's painful. And you have also a second category of people who are allergic to milk, to dairy. So those are two separated conditions, and I want to really go on the bottom of it to explain you the influence of lactose on these conditions. So for people who are allergic to dairy, they are in fact allergic to a protein that is called casein that's found in milk and dairy. So they can't, if they are in contact with that protein, they develop allergic symptoms. That's grave, and they should avoid dairy, of course. No, this protein is not included, doesn't exist in homeopathic medicines. The lactose we use is very pure pharmaceutical grade and doesn't contain any protein. It's just that milk sugar. So if you are allergic to casein, allergic to milk, the lactose in homeopathic medicine won't affect you. Now, the second thing is you are lactose intolerant. That means usually if you eat too much lactose, you'll develop symptoms. About 10% of the population still have this thing, but if you ingest more than about 12 grams of lactose and it reaches your intestine, you will develop symptoms. Now, what is the quantity of lactose that you find in, for example, 5 pellets? If you use our blue tubes, you take 5 pellets at a time. If you take 5 pellets, that represents 42.5 milligrams of lactose. Okay, a milligram is 1,000 of a gram. familiar with metric system, not being French. So 42 thousandths of a gram as compared to 12 grams that is usually a quantity of lactose that triggers symptoms. So not enough. The second thing is the absorption of homeopathic medicine is sublingual, means it takes place in the mouth. Very little of the lactose, if any, reaches the intestine, which is the place where symptoms of lactose intolerance start. So I would say you're pretty safe. Now, if you choose one of our medicines, a tablet form, like this one for allergy, the quantity of lactose in 2 tablets is about 10 times that. It's as if you were using 50 pellets instead of 5, so that's about 400 milligrams of lactose, not even a gram. Okay, 400 milligrams is 400 thousandths of a gram, so not enough. So I would say people who are intolerant to lactose know very well what amount of lactose triggers symptoms. Usually in homeopathic medicine, you don't have enough to trigger symptoms. But that's those are the quantities, so you know what is the choice. Okay, I have another question here. Let me see. Okay, so I have a few questions. Something for red and itchy eyes from environmental allergies and as such as dust, mites, no other symptom by the itchy eyes. That's a great question. So itchy eyes, you have 2 things to do. Sorry, thank you. The first one is to flush your eyes. In order to flush the eye efficiently, we have this medicine. I took it from my office because I'm using it for computer eye strain. It's called Optic One. It's called Optic One, and those are individual unit doses. I might be able to show them to you if I can open the pouch. Those are individual unit doses. They contain no preservative because they are individually packaged, sterile, and there is enough to flush both eyes. Very easy to carry if you are working. They flush both eyes and they treat. Not only you have the flushing effect, removing dust and particles, but you also have homeopathic medicines to relieve inflammation, to relieve swelling of the conjunctivitis, of the conjunctive membrane. And it also works on the feeling that there is something gritty, something sandy in the eyes, or when you have those flickering lights sometimes when you're tired. Those are symptoms that are relieved by Optic One. So I really recommend using it to flush your eyes and also to relieve the eye fatigue and eye strain. There is another one. Okay, let me see. I'd like to learn about a clingy child remedy, possibly even separation anxiety in a child. Okay, good. So let's do this. You have a child that's really close to you, afraid of separation. There is a lot of things that you can do outside of taking a medicine. I'm not going to go there, but I encourage you to really ask for, support or advisor from psychologists and some, because there is a lot of things, very simple things you can do. That's not my domain. So you can also use a couple of homeopathic medicines. In order to, it really depends on the reaction of the child, because some children are really angry because they are jealous. They feel that the little sibling takes too much place. So let's talk about that for a minute. Child is easily angry, jealous, sometimes violent, needs you, but overreacts maybe on the violent side. The medicine for this is hyoscyamus, and I hope this is recorded, so I will say it again. Hyoscyamus is HYOSCYAMUS, and you take it in 30C. It's a medicine that you will give to kids that are a little bit agitated, violent, needy, clingy, requesting attention, and they often get tantrums and sometimes get violent. They can have sleepless nights. So you can try that for, give them 5 pellets at bedtime and during the day 2 or 3 times if it's acute. If really it doesn't, it should go away in, let's give it a week, okay, to change their behavior. It needs to be associated with proper parenting techniques in order to, okay, set the boundaries and do the what needs to be done. It's not by itself, it's not the solution, but it can help. So another one, two other ones. I want to treat consistent sinus issues. I get bad sinus infection that make my 11-month-old sick too. So the medicine, first of all, you need to check if you don't have deviated septum, if you're if everything is all right there, because the main cause of sinus problems is deviated septums. That can be corrected at surgery. I'm not going to talk about that, but that you may want to investigate. Now, if you have sinus problem, you need to do two things. You need to keep your nasal cavity clear and clean. And the best way to do that is to use saline solution. So use saline solution, sterile, no decongestant. If choose one that's pressurized or you can refill, I'll add that to you. Needs to be clean, needs to be sterile. Don't use tap water. And regularly cleanse your nasal cavity, maybe 2 or 3 times a day, especially when you start a cold, when you have or if you have allergies. If your nasal cavity stays clean, the risk of sinus problem decreases as well. Now, if you start to feel pain in the sinuses, which are cavities under the eyes, above the eyes, sometimes here also, if you start to feel that pain, we have a medicine for that, which is called Sinusalia. I don't have a box here. Yes, do I? Let me see. No, I don't. But it's called Sinusalia, and it's an orange box. And you take the dosage is on the back, very easy to do, but you start as soon as possible. And the second thing I will recommend is take hot showers or steam bath to promote the the evacuation of fluid, the phlegm or fluid that you have in your nasal cavity. Be careful, because cold will create a constriction, so will decrease that ability for your nose to be drained. Try not to use decongestant, because the more you use them, the more you need them. And rely on Sinusalia, but take it as all homeopathic medicine as soon as possible. Do we have another question? Let me see. Thank you. Okay, so I'd love to learn if there is a medicine to help both milk supply and ear infection. So that's 2 questions. There is that's a very interesting question. First of all, if you are breastfeeding or pregnant, it's always a good idea to see healthcare professional before self-medicating, and that's our position as a company. Now, that said, I already mentioned homeopathycenters.org, the National Center for Homeopathy. They have a list of physicians skilled in homeopathy. But now, if you start the breastfeeding and you feel you don't have enough milk, there is a medicine that first you have to increase your water intake. Of course, to be sure you're very correctly hydrated. You have to start breastfeeding, because that helps with the reflex of secretion of prolactin, secretion of milk. And the medicine you can use is called Ricinus, R-I-C-I-N-U-S, but you have to take it in a low dilution, in 6E. Don't use the 30C. The 30C has the opposite effect. You use the 30C at the end to wean the child. So use Ricinus communis, Ricinus, R-I-C-I-N-U-S, 6E, 5 pellets, 3 or 4 times a day. And of course, all the other measures to increase secretion of milk apply. And there is no problem with interactions with breastfeeding. The medicine is safe at this dilution. Can you mix remedies in babies, camellia, and cough syrup or tablet? Yes, you can. I would recommend, when you give a homeopathic medicine, for example, camellia for teething, let let 15 minutes elapse until before you start giving something else, just to be sure that the medicine is absorbed, has the time to diffuse through the mucous membrane of the mouth and is absorbed. So you can combine them during the day, but try not to combine them together, okay? But certainly, you can certainly give the camellia for teething, the chestol for coughing. Just try to find a little space, 10-15 minutes between each one. Another question, okay? Ailments, so ailments we want to treat: cold, hot flashes. Ooh, okay, so let's try to do it in quickly. Cold, there are lots of medicine for colds, so that's why we created that formula, which is cold calm. Cold calm. So it contains homeopathic medicine for each stage of the cold: the onset, the established phase where you have minor sore throat, fever, and at the end when you're weak and you have sometimes very thick secretion. So I'm not going to go into details, but the good thing about cold calm is this: it exists in 2 forms, in 3 forms in fact. It exists in tablets or pellets. That's more for those are so blue orange tube this time. Those are pellets. Kids love them. If you have a kid that's 6 months and up, you can use the liquid unit dose. Exactly the same principle as camellia, something you squeeze in the baby's mouth. For kids 6 months and younger, we recommend that you see a healthcare professional before self-medicating, not because the medicine is toxic or is dangerous for kids, but because there is always a limit on self-medication, especially with kids. So always the same precaution. So you can use the unit dose for kids 6 months and above. You can use the pellets. Kids will. The good thing with pellets is kids, you don't have to hunt them or chase them around the house to take the medicine. They will tell you soon if they start. My throat hurts. They will tell you early. Because they are not afraid of the medicine. The medicine taste, is acceptable. And that's an advantage because homeopathic medicines work best when given early at the onset of symptoms. So for cold, I would say that's probably the best thing. If there are body aches and chills, that's probably more the flu. In that case, use oscillococcinum. Let me show it to you as well. There we go. Good. So that's to be taken at the onset of flu-like symptoms. You can give it to kids 2 and above. That's probably our best or most common medicine. Start to use this. For I didn't answer the hot flashes, or maybe there's a question of oscillo. How many tubes dose before we move on another remedy? Usually, and based on the clinical studies that have been made on oscillococcinum, there are 2 of them. You need 6 to 8 doses, taking 1 dose every 6 hours. It is not necessary to increase the frequency. 1 dose every 6 hours is largely enough. If don't wake yourself up or don't wake the kid up. If the dose is to be given in the night, it's better to let the kid sleep. But usually I would say 8 doses, and as soon as the symptoms are better. Usually we have the percentage, 63% of people taking oscillococcinum felt no symptoms or clear improvement after 48 hours. So that's the proportion. That's why I'm saying 6 to 8 doses. And you can, if you have the flu already, you can still take oscillococcinum. It's going to take longer because oscillo works better, like every homeopathic medicine when taken at the onset of symptoms. So that's probably the answer. But I would say even if it doesn't work that quickly, I would still consider taking oscillococcinum because that's the one that is the most reliable based on how many years we have used it and the clinical studies that have been made. Good. So another one, irritability and sleeplessness. So increase milk supply when nursing. I told you before, it's Ricinus, RICINUS in 6C. Low dilution always to increase milk secretion. Also interested in irritability and sleeplessness in a child. You have two medicines you can try. You have the one that's called for kids that are a little bit disturbed by Jadis or a new sibling. I told you about hyoscyamus, so go back in time. It's about 10 minutes ago. I extensively talk about it. You have also the child who is afraid of the dark and wakes you up, is woken up by nightmares, wants the little light, has sometimes kind of hallucination or he sees monsters and things. The medicine that you can give is stramonium, STRAMONIUM, in 30C, or it's a behavioral symptom, so you use a high dilution, 30C. You give 5 pellets 10 minutes before they brush their teeth, 10-15 minutes before they brush their teeth, before going to bed. You can renew during the night, wait 15 minutes, give them a little bit of water to clean their mouth, because of course the pellets contain a little bit of sugar, so we want to be on the safe side. If the child is very excited, you told them, okay, we're going to Six Flags or Disney World or something fun, and they have, they're excited, and you want them to calm down, to have a good night of sleep. You use Coffea cruda, which is a homeopathic preparation from the coffee bean, and you also use it in 30C. You give 5 pellets at 4 p.m., 5 before going to bed, before brushing their teeth. So those are 3 very, very good medicine that you can try for kids that have sleeping problems. Okay, so we have congestion, no discharge, cough, hearing loss due to congestion, recurring ear infection. Pulsatilla is not helping. 30C, you're trying 200C, modifying longer. Okay, so congestion, no discharge, cough, hearing loss. Pulsatilla was a good idea. I would recommend using a low dilution, not a high one, because you want to promote the flow of phlegm. You want to liquefy the secretion. If you want to liquefy the secretion, use low dilutions. If you want to increase secretions, use low dilutions. If you want to dry them up, use high. But here you want to go with nature. You want to go with nature. You want those secretions to flow and not to stay. So the best strategy is to go low, not high. So I recommend Pulsatilla, which is very nice for thick, yellowish secretion from nose, blocking the eustachian canal, so preventing the audition, blocking the ear, causing pain, and loss of smell and taste. The nose is dry at night and starts to flow in the morning, so you can try Pulsatilla. Another one for the ear, when it's thick, and it's especially useful for people who are bothered by congestion and with differences of pressure, like in the plane. The medicine is Calimuriaticum. Kali, K-A-L-I, and Muriaticum is M-U-R-I-A-T-U-M, and he also in 6C. So 5 pellets. Don't hesitate. If the symptoms are intense, if really it's very well congested, give 5 pellets every hour or every 2 hours. So frequently, and increase your water intake. Decrease the amount of diarrhea, because eating or drinking too much diarrhea tends to thicken the secretion. Steam showers, breathing steam helps a lot. Try to stay in a warm room always in order to promote this. So this is the best recommendation I can give for that. Should you dissolve pellets before giving to a toddler? Depends. Some are quite nice and they swallow it, and that's fine. But if you want to dissolve, you can take 5 pellets, put them in about 1 ounce of water, it takes about a good 5 minutes to dissolve. You don't nuke them, don't put them in the microwave. Just wait a little bit and you give that to drink. Or if you have a baby, you can take, and you need to give the same medicine or the same medicines during the day. You take the 10 pellets, you put them in a baby bottle, about 2 ounces of water, you mix that and you give a sip regularly during the day. And you refresh the solution every day. You don't keep it more than a day and you keep it in the fridge in between. I'd love to learn about option for eczema. Haha. Well, here we go back. Eczema is a chronic condition. There are very efficient homeopathic treatments, but here also the treatment is specific to the person. It takes into account the way the person or the child expresses the medicine. You have red eczema, itchy eczema, flaky eczema, or combination of all, vesicles and so on. So the aspect of the lesions, when they arrive, when they appear, what triggers them, how they evolve over time, this needs to be taken in account. So there is not one medicine for eczema. There are very adapted treatments. So I refer you back to the National Center for Homeopathy site, homeopathycenter.org, to find an MD skilled in homeopathy near you, and they'll probably do a much better job than me. And so, is there a medicine to be used during pregnancy as a prep? Many, like calcar-carb. Okay, so here also, you're pregnant, you want to self-medicate, tell a physician, find a physician skilled in homeopathy. That's our company position. Now, there are medicine that you can use in preparation for delivery, for example. One very nice is Gelsemium 30C, for 2 reasons. Gelsemium is a medicine for anxiety apprehension. It's very normal, especially if it's your first child, to be a little bit nervous. So Gelsemium, 5 pellets, 3 times a day for about 1 week before the date of the pregnancy. The date of delivery, sorry. That would be a nice thing. And also Gelsemium has a specific action on the uterus. It relaxes the uterus, so it will help with, between the contraction to really relax the muscle, allow blood flow and so on. Though Gelsemium is a great medicine for that. I will recommend also to take arnica, because it works on muscle strain, and God knows the uterus is working hard. And so you can take arnica, for example, 30C, 5 pellets, 2 or 3 times a day, 2 or 3 days before delivery. So those are things you can do. Besides this, I would say if your pregnancy is okay, there is not a lot of things you need to take. There is not something that will really help or prevent. The less you take, the better. But before delivery, you can consider those 2 options. There are also great medicines for after delivery. Staphysagria, if you have an episiotomy, if you have a surgical, or even for cesarean delivery, you can take Staphysagria, which is a medicine that will avoid the itching and the scarring of surgical wounds. Staphysagria, use it in 6C until the wound is healed. You can still use arnica, 30C, for a few days or until uterus is in place. Those are useful medicine for after delivery. There is also lots of homeopathic medicines for hemorrhoids at the end sometimes of the pregnancy. Some women have tendency to have hemorrhoids. I encourage you to be physically active. I encourage you not to eat too much, of course, and you have all these medicines. There is a question about hot flashes. Okay, hot flashes during they start perimenopause, and you have a medicine. I don't have it here, but it's called Actean. Actean is a medicine that's quite recent, and we have developed it. So Actean is A-C-T-E-A-N-E, Actean. It's like act, so you can act on your hot flashes. It's a medicine that Boiron has developed quite recently, and we started with the series of observational studies. So that's the box. Thank you, Actean. Series of observational stories in Europe to see which medicine were the most prescribed by homeopathic physicians to relieve hot flashes, and then we created the formula and we tested it in a clinical study. And what we saw on these about I think it's 400 women is that the frequency and the intensity of hot flashes decrease over a 12-week period. So really the treatment should last about 12 weeks. If you have hot flashes, so the dosage is on the back of the box. I'm not going to go there. It's very easy. If you have night sweats, that means you wake up in the night drenched, or you have those episodes during the day, and that can be not very comfortable. I recommend you take belladonna in 6C, just if you feel like it's coming, or 3 times a day, or before going to bed. If you know you're prone to night sweats, you can associate belladonna to Actean if you really have hot flashes with profuse sweating or night sweats. Okay, so growing pains for kids. Growing pain for kids, that's something that you can find in our medicine finder. So a lot of the conditions and answers I'm giving, in fact, they are collected for conditions that you can safely self-medicate. We have collected them in our medicine finder. So you can find on iTunes, on Google, or you can download them on your smartphone and your tablet. It's a free app, or even your Kindle, the nicer version. And the medicine finder allows you to find the best medicine, the best homeopathic medicines for more than 430 different conditions. Very specific to your symptoms, so you have a few questions, 3-4 questions to answer before you're directed to the protocol. And you have also a store locator, you have videos, you have coupons. Okay, so we try to do this. So Boiron Medicine Finder, you can download it, it's free. And if you go on the app, you'll find children, and you have another menu, and you'll find growing pains. And if you look at the protocol, there is only one medicine, which is Calcarea phosphorica in 6C. So there is a dosage written there. It's about 3 times a day. If the growing pain happen at night, that's what I had when I was a teenager. You take the 5 pellets before going to bed, before, of course, brushing your teeth. And that works very, very well, because that really can be bothersome, and you don't necessarily want to give ibuprofen or Advil for this kind of things. You want to decrease the amount of conventional medicine which have side effects. So Calcarea phosphorica for growing pains in teenagers. Medicine for something that aid in focus for kids. Haha. Well, that's an interesting question. Besides everything you can do psychologically to help the kid focus, and there is a lot of things you can do. I know training them in meditation, being mindful, help them a lot to know that they have an ability to focus, to really focus on something. And okay, now you have also to be sure they have enough, they have a good regimen rich in magnesium. Kids that are low in magnesium, that are stressed out, they tend to have more difficulties. You have to watch how they sleep at night. Really, if they don't have a good night's sleep, they will be less able to focus. Now, if the kid is really, and I'm talking about more than kids now, I'm talking about 12-year-olds and above, they are tired because they prepare exams. They have, they cram through their course. They try to learn as much as possible, or they or even they practice, and they are intellectually exhausted. That promotes lack of focus. They just don't want, they lose interest. You can help them with the medicine Kali phosphoricum. Kali, Kali phosphoricum, start like phosphorus. Use it in 30C, give 5 pellets 3 times a day. It's going to help with the intellectual fatigue. Of course, rest is the best medicine, easy to say, but always consider, before going to give a medicine, always consider common sense measures, making sure they rest, making sure they don't sleep with their tablets or their iPhone and all the night and things like that. So Kali phosphoricum 30C. 3 questions left, and we have to wrap up on summary. So let me try to see if we have another one. Ear infection, dosage for pulsatilla and Kali muriaticum. Okay, so ear infection. First of all, you need to monitor the temperature. And this goes for about everything I'm saying. Every time the kid is not okay or you are not okay, buy a thermometer and take your temperature three times a day and keep the numbers to see if it goes up, goes down, stays flat. That will give you a lot of information. Now, ear infection, you need to monitor the temperature, because really you can work on the first stages, on the congestion of it, and you use always low dilution. There is a buildup of secretion behind the eardrum in the eustachian canal. You need to have that drained. So use low dilution, increase the amount of water, decrease the amount of diarrhea, promote heat, steam bath to help with vasodilation of the ear and drainage of the cavity. So pulsatilla or Kali phosphoricum in 6C, 5 pellets, I would say every 2 hours if it's really intense. Now, for the pain, if there is pain, you can use a medicine called capsicum. Capsicum is a homeopathic dilution of red pepper. So capsicum, 6C is fine also, 5 pellets, the same with them, 3-4 times a day with the pain. If really, it's not difficult to look at the eardrum and see if it's only slightly congested or if it's really, but if it becomes, more than 2 or 3 days, it's better to see a healthcare professional, because you don't want to risk an infection and losing audition. So those are my recommendations. So, and take it as soon as possible. Don't hesitate to start the treatment, the homeopathic treatment, as soon as possible. That's where it works the best. So recurring yeast infection. So Mercurius, 200 CK. Yeah. Okay. So. And what medicines are safe or not safe during pregnancy? Good. So if you have recurring yeast infections, that means really infections every 2 months or less, there is an underlying cause. There is something else that needs to be discovered. So see your OBGYN, see if there is not a problem with thyroid, with immune system, or something else than just regular yeast infection. So that's my first thing. We have a set of medicine. We have a medicine called Yeast Away. Those are suppositories, vaginal suppositories that you use to course. It's a 7-course thing. I'm not completely sure Mercurius solubilis would be the best. It's not the first one that comes to my mind. I would certainly try Candida albicans in 30C. And you have different types of medicines for, especially for itchiness. If it's really inflamed, you can try belladonna. 6 or 6C is fine. Really, I would try first, if it's really that frequent, try to see the cause. Try Yeast Away, but you shouldn't have infections more than twice a year. they are frequent, they can happen frequently. I don't remember the proportion, I think it's 3/4 of the women have at least one yeast infection during their life. If it's your first yeast infection, see the physician. If it's your first one, see a physician to be sure that it's the common one, there is nothing else. That's important. So, okay. Another one, last question, sorry. Does mint affect remedies? Well, the only time where you should avoid taking anything in your mouth is really when you take the pellets or anything sublingual. Anything in the mouth at the same time of the medicine will compete with the absorption and will reduce the absorption of the medicine. That's true for anything that you put in your mouth, mint, chocolate, coffee, tea, whatever, food. So doesn't matter if your stomach is full or not. What matters is try to take the medicine in a clean mouth, rinse your mouth with water, take the medicine, let them diffuse through the mucous membrane. But in France, we use mint, coffee, and so on. It doesn't seem to affect the activity of homeopathic medicines. I think it's a myth that comes from the first days of homeopathy, where the first physician in homeopathy wanted to be sure the patients didn't take anything else than the medicine to validate the fact that the medicines were working. So nothing in excess. So see, if you have more questions, we need to stop. If you have more questions, you can visit BoironUSA.com on Boiron USA on Facebook. Sorry, so Boiron USA in one word on Facebook. We will definitely, answer your questions, and the one that probably I didn't take the time to answer. Explore the Medicine Finder. Okay, that has been downloaded 500,000 times. People like it. They spend time on it, 3 minutes in average. It's a wealth of information, and it's free, of course. And I think I'm going to thank you all the moms, all the people who spent time with us. I hope it was interesting and enjoyable, and we'll see each other on, probably the next time. Have a very good end of the day.